executivo da Abrasco, da nossa Associação Brasileira de Saúde Coletiva. Estou me apresentando porque nós temos hoje um evento extremamente importante
important event for the professionals in the health sector and scientists of all areas for the population, which is now at Ágora Abrasco, which the theme is equity in global health in times of pandemic. I'll be followed today by 3 great people. I'm very happy about that, and I thank the opportunity granted to me to coordinate an event of such magnitude. I'm referring to Marmot, professor recognized worldwide, one of the biggest specialists in social determinators in health, and the director of the equity in health for the University College in London. I'll be also followed by, also very important, honorary member of the Medicine Academy member of Brazil, granted by the Academy here in Brazil. I'll also be joined by, with great honor and pleasure, by Professor Helena Nader, professor of the Medicine University of Brazil, Vice President of the Academic University of Sciences, and co-chair of the Inter-American Science of Medicine, which gathers all the science academies of the hemisphere, United States, down to the south of the continent, and former president of our dear Brazilian Society of Science Progression. Also joined by Gulnar Azevedo, main professor for UERJ, the university, and also Abrasco president, doing a wonderful job. We're going through a pandemic, which is no surprise. It didn't start by surprise for us. We were aware that this risk was imminent, and it materialized in January this year, when the first case was reported, now named COVID-19. We are in a 8-month process. What it has shown us was that besides having an enormous capacity of expansion of the virus, it has shown us a great death rate, and above all, something that we knew, but it was made very evident in the distribution of cases and deaths by this. It was the amount of inequality present in the planet, in society. In each country, in each region of the country, this inequality in the distribution of deaths and cases is not something natural, not even something unexpected. Actually, it reaffirms and reveals that we live in an extreme unequal society and unfair, in which many are the excluded ones, and we have a society in which we have an immense concentration of wealth, very few with a lot and many with almost nothing, and it's exactly those the most affected, both by the infection as well as by the lethality provided by this infirmity. This is our reality, and we should not, upon any circumstance, not talk about this. We're having reactions from this. There was a movement created globally for the global equity, the sustainable equity of health, the equity movement, in which Abrasco is part of the Brazilian American Science. The the one which I welcome very dearly. The many institutions and doctors here in Brazil have adhered to this very important movement, which is the defense of equity in the access to the wealth, to the products, which are able to mitigate the effects of such infirmities, and as well thinking about the post-disease, the post-pandemic, in which we may come to a more equal world, a less unequal world. We have serious doubts whether we'll achieve that. However, it's a challenge we must put in our heads permanently. If we get out of this into an unfair world and an excluded world, such as we had before, with environmental aggressions and unbearable, with immense social inequalities, will for sure be keeping the conditions which have brought us upon this, and the ones which have propagated the pandemic. We'll talk briefly about this as well. What awaits us in the future, in the post-pandemic, our expectations. So these three important personalities, scientists from our time in the public health and Brazilian health, as well as worldwide, will grant us some of their comments and reflections. And we'll be starting with Professor Marmot. He's on vacation, so I thank him very much for being here, trying to recover a little bit all the difficulties which have brought us. And even in vacation period, him, as he enjoys Brazil very much, and Brazilians enjoy him very much, he's granted some of his time to participate in our event. Professor Marmot, you're very welcome once again to Brazil and Latin America, because I can see here that we have such a great audience of not only Brazilians, but Latin Americans and in other countries of the world. I can see a lot of accesses on YouTube. I grant you the word now with great satisfaction. You have 30 minutes to perform your presentation.
Thank you, Paulo. And it is an absolute pleasure always to interact with Brazilian colleagues and friends. Oops. That wasn't supposed to happen. I'm going to talk about global health equity and the pandemic. I hope, have a global perspective, but we have very good data from the UK. And so I will draw, as I go through, on the data that we have from the UK to make some points that are more general. Paulo was a member of the Commission of the Pan American Health Organization on Equity and Health Inequalities in the Americas. We reported on the 1st of October last year. And I'd like to think that what's happening now with COVID-19 makes what we reported last year even more relevant. I've been saying pretty well from the beginning of the pandemic that it exposes the underlying inequalities in society and amplifies them. We quoted in our PAHO report from Nelson Mandela, overcoming poverty is not a gesture of charity, it is an act of justice. It's the protection of fundamental human rights, the right to dignity and a decent life. And I'll come back to that at the end. This was the conceptual framework of our PAHO Commission. We looked at the structural drivers political, social, cultural, and economic structures, the natural environment, land and climate change, and ongoing colonialism and structural racism, the conditions of daily life, and then 2 mechanisms for taking action, governance and human rights. And we took the approach of intersectionality, looking at social and economic inequities, gender, sexuality, ethnicity, disability, and migration. You will know this well. I'm drawing now on a report from the Human Development Report from the UNDP. And you can see HIV/AIDS, transport injuries, self-harm, and malaria deaths, and what happened with COVID-19. It swamps all these other deaths globally. It's really quite remarkable. And the UNDP has looked at the likely effect on human development globally of the pandemic. So this is the Human Development Index, which, as you know, combines life expectancy, education, and economic fortunes. And you can see the global financial crisis did have an effect on human development. But look at the effect of the pandemic that's predicted to have on human development. So when we think what the global financial crisis did to the world, the pandemic is going to do a great deal more. And all external shocks amplify inequalities. The example in Puerto Rico with Hurricane Maria and the excess mortality by socioeconomic group, the lowest, medium, and the highest. And you can see that the excess mortality was much bigger in the lowest socioeconomic group. So external shocks like a hurricane, like the global financial crisis, and like the pandemic, increase inequalities. I'm not going to talk about the healthcare system. The healthcare system is vital, but I'm not going to talk about that today. The opening line of my book, The Health Gap, was why treat people and send them back to the conditions that made them sick. So I'm going to talk about the conditions that make people sick. And I said I want to use England as an example. After the WHO Commission on Social Determinants of Health, I chaired a panel and produced a report, the so-called Marmot Review, in England in 2010, adapting the recommendations and findings of the WHO Commission for one country, England. And in February this year, I published Health Equity in England, the Marmot Review 10 years on. We looked to see what had happened in the 10 years since the original Marmot Review. And the answer was, we've lost a decade, and it shows. This was life expectancy in England, increasing. I'd taken this back to 1980. I could take it back to 1900, increasing about 1 year every 4 years. And then 2010-11, that increase slowed dramatically. It just about ground to a halt. The question is, what happened in 2010-11? Well, what happened was we got a new government. And the question was it actions that that government took, most notably austerity, that led to this slowing of life expectancy? And when we look at what happened in the UK, the improvement in life expectancy between 2011 and 2017, all of these countries had more rapid improvement than the UK, except Iceland and the USA. So we looked very poor coming into the pandemic. My report was February 2020. We were in a bad situation coming into the pandemic. And when we look at what happened in the pandemic, this is excess deaths. Now, there's difficulty doing international comparisons of mortality due to COVID-19 because of different ways it's diagnosed and cause of death is assigned. Excess deaths is a calculation of, during the time of COVID, how many more deaths were there in 2020 than would have been predicted on the basis of the previous 5 years. And the excess deaths in England were the highest of any European country and higher than the US. So putting these two things together, our slowdown in life expectancy was more dramatic than in other countries, except Iceland and the US, and our excess mortality from COVID-19. I think we've been mismanaging very badly. This is the social gradient in mortality by degree of deprivation in England. And as I hope you know, it's not just that the most deprived have shorter life expectancy than the least deprived, but it's a social gradient. And from 2010 to 2020, that social gradient got steeper. And when we look regionally, and by deprivation, if you look at the least deprived areas in England, life expectancy improved and there wasn't much difference by region. If you look at the most deprived 10%, life expectancy for people in the bottom decile went up in London, but went down in every other region. And particularly for women in the poorest 10%, life expectancy declined. So now let's look at COVID-19 by deprivation in England. The blue are COVID-19 deaths. You see the social gradient. And the gray is all deaths. It's almost parallel, the social gradient for all-cause mortality and the social gradient for COVID-19, which means that the causes of inequalities in health and the causes of inequalities in COVID-19 overlap considerably. There's some excess of COVID-19 at the bottom, which we think is related to being a frontline worker and being exposed, living in crowded accommodation. And the same thing in Scotland. There's the social gradient for all causes, and there's the social gradient for COVID-19. Very similar gradients. We are concerned about so-called Black, Asian, and minority ethnic groups, high mortality from COVID-19 in Black, British. And most of that, at least half of that, can be attributed to deprivation. And in women, more than half is deprivation. Bangladeshi or Pakistani, excess mortality, and more than half is attributed to deprivation. In my 2010 Marmot review, I had 6 domains of recommendations. Give every child the best start in life, education and lifelong learning, fair employment and good work for all, having enough money to live on, healthy and sustainable places to live and work, and taking a social determinants approach to prevention. I won't go through them all now, but in my 2020 report, we looked at what had happened in all of these, and the news was not good. Into the government, the Conservative-led coalition government that came to power in the UK in 2010 said they wanted to roll back the state to reduce public expenditure. And they did it. In 2010, public sector expenditure was 42% of gross domestic product. And by 2018-19, that had gone from 42% to 35%. So that's crazy. That's enormous, that reduction in public expenditure. And they imagined they could do that with no ill effects. Well, it's highly likely that that rolling the state did have ill effects. It damaged the health of the population, and it was done in a most regressive way. This is spending by local areas, councils. And if you look at the gray, you can see that in the least deprived 20% of areas, spending went down by 16% per person. And then the more deprived the area, the greater the reduction. In the most deprived 20%, spending went down by 32% per person. Now, the more deprived the area, the greater the need. And the greater the need, the bigger the reduction. I showed this slide to a WHO economist, and she said, "You're making this up. I've never seen anything quite so regressive as that." Well, you can see why health might be damaged more in more deprived areas than in richer areas. The problem with this strategy of austerity done in a regressive way, the government said they wanted to restore economic growth. Well, it didn't work. This is wage growth in the UK 2007 to 2018 and other OECD countries. The UK had negative wage growth. Only lower were Mexico and Greece. And every other country had greater wage growth. They didn't indulge, except particularly for Greece, in the same degree of austerity.
Eu acho que nós tivemos uma paralisação.
I think we have had a
Não, Michael.
frozen.
Ok, voltou.
Michael, you're muted. You're still muted.
Oi, sim.
Can you hear me, Michael? Michael, can you hear me? You're still muted.
Rich country. These people had food insecurity pre-COVID-19 and during the pandemic. 2 million children were food insecure during the pandemic. And lockdown, of course, meant children couldn't go to school because the schools were closed. And if you look at the least deprived and the most deprived schools, in the least deprived, not behind at all, 3%, 1 month behind in their learning, 24%, 2 months behind, 32%. In the most deprived, the children fell much further behind. So closing the schools increased the inequality in educational performance. And if we look globally now, and this is from the UNDP, the out-of-school rate for primary education before COVID-19 and during COVID-19 closure for low levels of human development, medium, high, and very high. And you can see the huge impact on out of school for primary education that's bigger and bigger and bigger the lower the level of human development. This will have a catastrophic effect on children's educational performance and what happens later in life. This is the effective out-of-school rate for primary education, which had been coming down very nicely since 1970, and then is predicted to leap up to there. Now, if there were no internet availability, it would go even higher. But if they could close the internet gap within the Human Development Group, in other words, if deprived people had the same high level of access to the internet as more affluent people, then that would have a very positive effect on the out-of-school rate. So something as soluble as internet exposure, internet accessibility could make a big difference to this inequality in education. And looking globally, again, low level of human development, medium, high, and very high, people in low-income groups are much more vulnerable because of their ability to come up with emergency funds. So this is the percent of people who are able to come up with emergency funds by quintiles of income and wealth. Again, the lockdown and the pandemic is going to exaggerate inequalities globally. The scale of fiscal measures related to COVID-19 depends on a country's level of human development. This is direct spending. The greater the Human Development Index, in other words, the more affluent the country, the more they're able to spend on dealing with the fallout from societal closures, and similarly with loans and guarantees. Today's news from the United States Senate was they failed to agree a renewal of the spending plans. This is for one of the richest countries in the world. They've stopped spending to support people who are out of work. I said I wanted to come back to the issue of human rights. I'm up to the minute. These data were published today, but I couldn't resist. Let's look at 3 countries that had very different experiences with the pandemic. Germany, that controlled it very well, the USA, that controlled it badly, and Brazil, that controlled it badly. And an index of inclusiveness of the society, this social progress index. Germany doing well, and a modest improvement in inclusiveness. USA, close to Germany in 2011, and then dipping much further. And Brazil, a dramatic decline in inclusiveness. An index of personal safety. Germany, high and stable. The USA, the index of personal safety declined dramatically in between 2016 and 2017. You can guess what happened in the US in 2017. And in Brazil, it's been declining. So and there are many more indices of social progress. But crudely speaking, they seem to correlate with how well a country handled the pandemic. Germany handled the pandemic very well, and its social progress is acceptable and improving a bit. The USA and Brazil handled the pandemic very badly. And it relates perhaps to the fact that their social progress before the pandemic had not been good. Paulo Bus said in his introduction, we need to think about sustainable futures. In my 2020 report, we pointed out that PM10, air pollution, was higher in more deprived areas than in less deprived areas in all of these English cities. And we said that we have to bring the climate change and the health equity agendas together. And as we think about building back better, I commend this to you. A well-being approach can be described as enabling people to have the capabilities they need to live lives of purpose, balance, and meaning for them. Where might I have got that quote? Amartya Sen? Yeah, possibly. But no, I got it from the New Zealand Ministry of Finance. The New Zealand Ministry of Finance said in 2019, before the pandemic, said, we want to put a well-being approach at the heart of our financial planning. A well-being approach can be described as enabling people to have the capabilities they need to live lives of purpose, balance, and meaning for them. That is how we should be building back better. Thank you. Oh.
Como sempre, Michael, thank you so much for your terrific presentation.
Terrific presentation.
E você sempre nos surpreende, apesar de esperarmos sempre a sua alta qualidade.
We always expect your high quality in your presentations. You always seem to surprise us, and I believe that
belíssima e importante lição aprendida com a sua apresentação sobre os efeitos agora tão bem documentados nesse seu trabalho sobre a desigualdade na pandemia, sobre o quanto essa pandemia nos revela um mundo profundamente desigual, e essa comparação de países que você nos fez ajuda muito a pensar como a saúde pública e a ciência brasileira podem se inspirar nesse tipo de trabalho, produzir documentos, estudos da forma como você nos produziu, tanto brilhantismo, mostrando esse impacto da pandemia sobre desigualdades pré-existentes que se aprofundam com a enfermidade epidêmica nas nossas sociedades. Eu imediatamente passo a palavra para a nossa convidada, Helena Nader, para fazer seus comentários, e depois a nossa presidente Gulnar. Helena, você tem 10 minutos para seus comentários a respeito da apresentação e agregar o que você julgar oportuno.
Add anything you find reasonable to add.
Helena, tem que ligar o seu... Isso.
I want to thank Professor Marmot. Fantastic. You made me cry because the reality you showed us, it's so hard because we know about that. But to see in a graph makes things more realistic, more impact. Eu quero realmente agradecer a...
I would really like to thank Ágora,
nossa querida Abrasco,
our dear Abrasco, Paulo, Gulnar, and all from the board for this opportunity. Data that Professor Marmot has brought to us today, I would like to see if you have published it so we can have access to it. We have to widen the publishing of these curves because they speak for themselves. You always say this, but people would just say, but yeah, it's just your impression. We have quantitative data in this presentation in percent. And really here in Brazil, we always say the inequality has been increasing ever more. And a comment that Mr. Marmot has said regarding children in school. On Tuesday, we had a debate in the Brazilian Academy of Sciences, specifically about basic education. Children from elementary school to high school, the impact it's being on these children's lives, the absence of school, not only for the absence of the contact with other people, but eating, because in schools they would have meals. So it's an impact. The malnutrition will arise. In younger ages, the lack of adequate nutrition and the impact in the development, the neurological development of these children is indeed, she would like to thank once again this data that shows us in a very explicit way. Another thing I would like to bring here for us to, people who know me, I know I'm very critical for the absence of state policies. We have this trait here in Brazil. A government policy, not even this kind of policy for governments we have, and this was made very evident during this pandemic. And on the other hand, I would like to highlight an issue that we still have a positive side to our country. Abrasco and ASPPC and have struggled very much with civil society to build the unique health system. Imagine what would have been, it's still ongoing, and what would happen during this pandemic without the unique health system, which is harmed. It's badly financed. Another point I would like to bring here, just to add up to it, a little bit before the webinar, we're chatting about the Inter-American Partnership, which gathers all the academics. And today it is divided. There is the health, the science, and political sectors and or policies in that matter. Thanks to the work of Paulo here in Brazil and Marmot in England, coordinating the whole part regarding health, we have managed to involve the IP in the discussion of inequality. And they have released a statement which is rather interesting. It's interesting because if you observe, Margaret signs it, and it is through the American Academy. And when we tried to gather the signature and we asked the American Academy, and the Canadian one did not want to sign the equity agreement document for the fact that Alice brought up inequality, which leaped to the eye between countries and the fight for the purchase of masks and ventilators and other protective gear. And there's this document which was released from, let me open here in my computer. We have the title of this document, which is a report for distribution and acquire of vaccines, which is what we wanted. And they're saying that there must be a central effort, otherwise we'll have even more inequality. Unfortunately, financial lobbies exist. Rivalries and preferences between countries also exist. The fact that IP has released this report, I believe it was last week or this week, gave me hope that maybe we'll be able to develop something global. Not only considering Brazil, we'll have people, countries, regions, even within a country. Here in Brazil, Professor Marmot, where
who is going to have the first vaccine. So one is enrolled with Oxford, the other one is enrolled with China, the other one is enrolled with Russia, and so on. Em vez de nos envolvermos,
instead of getting involved together to gather what is best for the country. So you can imagine what we are having in terms of global levels. So it worries me very much, the inequalities that are to come, and the income inequalities, as you have well put. Once again, we were in Brazil, we were growing the pyramid of life expectancy. We're losing the difference a little bit regarding social areas, and this will not help very much in that matter. So children who are not getting proper eating and proper learning. Of course, you must not consider this because here in Brazil, well, in England, you have the problem of internet. Here, we don't even have internet in our schools. We'll have to restructure schools. I was informed the other day in a debate, we still have a lot of schools without windows. They're like prisons. So what country is this, is what I would like to say. I'm closing up and I'm thanking Paulo for the opportunity to watch a lesson of citizenship and human rights, as Mr. Michael Marmot has provided us. Thank you very much. Thank you very much, Helena. You could have watched through YouTube. I think the important here is to show a scientist of your greatness and quality, the social insertion and political insertion that you have, the militance that you have towards science, and we're very thankful for your extraordinary work here in Brazil as well. I think your comments, I think this mention you have of inter-academy partnership is rather important, and I will invite our over 200 participants of this webinar to visit the web page. It's rather simple, Inter-Academy Partnership, and also visit the web page Sustainable Equity Health Movement, because these things are present. And I would like to once again thank Helena. I'm receiving comments here from Marmot, even about you. Thank you once again. Let's keep in touch with Marmot, because you're part of the committee. And now my president, Nader Azevedo, who's doing an extraordinary work. Abrasco created a group they developed in the absence of a plan of how to handle the COVID. Abrasco and other entities prepared a document which was delivered, Michael, to the government. The Brazilian parliament demanding solutions and offering a plan to face COVID. This is Abrasco's work for public health, which in no way alienated as it is done in other spaces and regions. We notice this alienation of science. This Academy of Medicine, which is also in the front, and Abrasco, obviously, for being our great public health association, and it's been exemplary in how to conduct debates in terms of politics and equity in our society. Nader, President, 10 minutes to you. Go ahead.
Seu som, Gulnar.
Oi. Eu queria começar agradecendo
I would
muito.
like to start by thanking Professor Michael Marmot very much for accepting the invitation to be here with us, participating in this panel, for the brilliant talk he has just done. I thank our partner Paulo for suggesting and organizing this activity within our Ágora. And I thank very much Helena Nader for being with us once again, enriching this debate. This is an honor to be with you here today, as this is a very necessary discussion, rather important. The world is being very punished at the moment for many months during this pandemic. And I would like to remind you what has been briefly mentioned once again: the delivery of this document, Inequity during pandemic, a shout for leadership, where Abrasco has signed a document together with the Federal Social Public Health Organization, the American Associations, other 180 institutions and 300 leaderships. This document delivered to the Executive Secretary of the World Health Organization is rather important, because the international cooperation is rather fundamental to hold all the necessary resources to all countries to stimulate national production, access to medication and supplies to all countries. And speaking of which, Brazil has performed a movement to support, and I believe it was rather important with the leadership of Paulo, and I believe that was very important to put it to practice. But I want to take this opportunity, this moment, to get your attention to the situation this country is going through during the pandemic. Even though in some cities we notice a certain acceleration of the transmission, we have no safety. We're not sure that it's being under control around the country. You know, the consequences, which will be much worse for the vulnerable population, the one who suffer every day the consequences of social inequality. So it's fundamental for us to bring this theme forward. At the Collective Association of Brazil, we've been warning everybody since March, which was proved the transmission of the SARS-CoV-2, in which the public government has not fulfilled its duty here in Brazil. It has not presented then and until now an integrated procedure between state and municipalities of correct procedures regarding public health. On the other hand, we watch a president who goes against of what has been the experience of the other leaders in other countries, and we have a much worse crisis. The sanitation people, we have started in March a work with the World Health Organization, the social control within SUS, the construction of a great movement, the Front for Life through SUS for democracy. Since then, we have been aggregating other entities in the area of health and organizations of civil society and building together, as Paulo mentioned, a national plan to face the pandemic for COVID-19. This plan was released in July 3rd, delivered to the sanitary authorities and the National Congress. And we have been showing that this is a pressure strategy within this plan. We include an ample debate as well as open. We want this to be a fundamental strategy for pressure so the government fulfills its duty. This plan has been providing debates all across the country, and we make it very clear. I'll try to make it sure that in order for us to face COVID-19, it is necessary an articulate system integrated with tactic strategies and articulations, and the success of this implementation and system for all these actions will depend on the capacity to mobilize the population, and we include all the users and managers and health professionals, legislators, in a cohesion of solidarity and responsible attitudes. It will be much more effective the more it is focused not only in the efficient planning, but as well as valuing democracy, in which we fight for to keep here in the country. So I would like to take the opportunity here, the presence of Mr. Marmot, and highlight two passages through Brazil, in reference to Brazil, very important. One of them is in an editorial published in 2016, in which he had entitled Brazil, Quick Progress and an Equality Challenge. In this paper, he called the attention in which, although some progress has taken place, there's still a lot of inequality here in Brazil, and this is the challenge. Yeah? And he even adds in the last paragraph of this editorial, let's observe with great interest whether Bolsa Familia and other social programs not only contribute for the improvement of health takes place in Brazil, but also to reduce inequality. Well, 2 years later, he was with her in the Congress of Abrasco back in 2018, and here he had a talk in which was named Social Inequalities and Strategies to Overcome Them, and which was excellent. He again expressed his concern with our inequality, getting the attention to the importance of social programs such as Bolsa Familia. Now, in 2020, we're watching a political crisis installed in Brazil with an ultra neoliberal government, which disregards the science development and social programs well known with great power to reduce inequality. So I would like to hear from Michael Marmot, our guest today, what he can say to us, what message he has for us today, so Brazilians and us sanitizers can keep on going with the hope that we can beat this inequality. This is the question I leave to you. What message do you have after the editorial for 2016 and 2018, coming back to Brazil virtually in this debate regarding inequality and pandemic? Thank you once again. Thank you. It's an honor to be with you here. Excellent, President. I think it's wonderful. Mr. Marmot, you have the floor, as Gulnar has a question for you. And this is important because your participation is
honorary, Brazilian honorary. So please, your comments about this challenge, Gulnar, raised for your comments, please.
Well, it is a challenge. I've been arguing since we started the WHO Commission on Social Determinants of Health that the health of the population tells us a great deal about how well society is functioning. And inequalities in health tell us a great deal about inequalities in society. So before I take up your question about Brazil, when looking at my own country, the UK, I said that in my 2020 report that the fact that health had stopped improving and inequalities had got bigger meant society had stopped improving and inequalities in society had got bigger. So the first thing is we need the evidence. And that's absolutely vital. And I drew on my English evidence because we have a lot of it. We're trying to get global evidence on the impact of the pandemic on inequalities, but it's difficult to get. Most countries don't have the evidence. But the more evidence we get, the better. And to take up your challenge, Paulo will remember what I said when I was being installed as an external member of the Brazilian Academy of Medicine, that when we're faced globally with politicians who disrespect science and who can't be trusted to tell the truth, we need to draw on the fact that doctors and nurses particularly, and other healthcare workers are trusted, rightly so. I cited evidence in my acceptance speech that, admittedly, this was a British survey, but I think it would be similar. If you ask the general population, who do you trust to tell the truth? Nurses are number one, doctors number two, and then scientists, teachers, judges. Well, I would imagine all of us at this seminar fit into one or more of those categories: nurses, doctors, scientists, teachers, maybe not too many judges here tonight, but the others. And we're trusted by the population, and rightly so, because we tell the truth to our colleagues, we tell the truth to the scientific literature. We would be frowned on if we didn't tell the truth in our published papers, and we're rightly trusted. And secondly, I would argue that we are all concerned with social justice. So we have to be in the lead in the fight for more just societies, because we are trusted by the population, we have earned that trust, and we're concerned with social justice. And these health inequalities exposed by the pandemic are markers of an unjust society. So we have to be in the lead. And you in Brazil share with us in the UK lack of respect for our leaders who can't be trusted. So I don't look at Brazil and say, poor Brazil, we've got it fine in the UK. I look at the UK and say, we're in a terrible state, as is the United States, as is Brazil, as is Hungary, as is Turkey, many countries. Well, those of us who are on the side of social justice and who are rightly trusted to tell the truth have to be key in this struggle.
Muito obrigado, Michael, por mais esse comentário.
Thank you very much, Michael, for this comment. I would like to tell you and remind everyone, hundreds of Brazilians who are watching us, Latin Americans who are watching us, and also some people from Europe and the United States I can see here. I would like to tell you that we have elections here in Brazil. To all the 5,800 municipalities within the next 2 months. All and any change you have brilliantly put will depend on the leadership we'll be choosing to conduct these cities in Brazil. So we have the opportunity in these municipal elections to produce some changes in local governance, both in mayors as well as in council people, legislators in municipalities. And our call is for that every one of you Brazilians who are present here watching us strongly take into consideration this matter of equity in health, social equity matter, the inequality matter, and we know how to charge these plans presented by the candidates, the priority in which they will give, especially the social inclusion and how to face inequality, because indeed this is the biggest evil we have in Brazilian society, as you have mentioned, sadly in the United Kingdom and sadly in the United States, which are leaders that are not well trusted. We have to start a questioning process of the situation through municipal elections, in which Brazil will take place in 2-3 months approximately. So it is an important political moment. We'll be working on this. I would like to thank once again the time you have dedicated to us Brazilians on vacation in such a wonderful region in Italy with your family. Thank you for providing 1+ hours of your time. You're an honorary Brazilian, Michael, not only a member in the Health Academy, but I know how much you like Brazil and how much Brazil likes you. Thank you. I would like to thank Helena, brilliant. President Gulnar, brilliant. Everybody who's watched us. And share this program. It can be watched at Ágora Abrasco. I'm being a TV host now. Share this video. I think this deserves to be watched by many other Brazilians and Latin Americans and people from global society. Thank you, everyone. A good afternoon and good evening.
Thank you.
Thank you.
Obrigada.
Thank you very much.
Tchau.
Bye-bye.
Tchau, muito obrigada. Thank you very much, Michael.
Thank you. That was wonderful. Thank you.
Bye-bye.
Thank you very much.
Bye, Michael.
Tchau, Pedro. Tchau, Luiz Eugênio.